All right, welcome everyone. If you're studying to be a pediatric nurse, this is for you. Today, we're diving deep into the really unique world of a child's musculoskeletal system. This is basically your guide to understanding how to assess, treat, and ultimately protect the very framework of a growing body.
Okay, let's start with the single most important idea you need to get. If you remember nothing else, remember this. Children are not just little adults. It's the golden rule, really. Everything, and I mean everything, from how their bones break to how they heal is completely different. And getting that difference is the absolute foundation of great pediatric care.
So, here's our game plan. We're going to start with exactly why kids are so different. Then, we'll look at the growing blueprint, the anatomy itself. From there, we'll get into what happens when bones bend and break, spotlight some key conditions you'll see, and wrap it all up with your critical role as a nurse. Okay, Section 1. Let's really hammer this home. A child's skeleton is a work in progress. It's got these unique strengths, but also some major vulnerabilities. And all of that completely changes how we approach their care. They are not, and I'll say it again, scaled-down versions of adult bones.
Now check this out, because this is where things get really interesting. It's almost a complete reversal of what you see in adults. You know how you always hear about adults tearing a ligament or a tendon? Well, in kids, their ligaments and tendons are actually stronger than their bones. That means when a kid takes a fall, the bone itself is usually the weak link. It's the part that's more likely to get injured.
So, to really get a handle on pediatric injuries, and more importantly, how to nurture healthy growth, we have to understand the blueprint. We need to look at the structures inside their bones that allow for all that incredible growth to happen in the first place.
Okay, so here are the key parts of a long bone. You've got the epiphysis at the ends, the long central shaft called the diaphysis, and the metaphysis that connects them. Knowing these zones is super helpful for pinpointing fracture locations. But wait, there's one more piece here, a part you won't find in an adult, and it changes everything.
And here it is, the physis. You probably know it as the growth plate. This right here is the engine of growth. It's the area that's responsible for the bone actually getting longer. But because it's made of cartilage and is buzzing with cell activity, it's also a weak spot. It's a really common place for fractures. And this is a big deal, because an injury right here can seriously impact a child's future growth. And this image just illustrates that journey perfectly. You can literally watch the bone go from this flexible, cartilage-heavy structure to a solid, mature adult bone. And that whole incredible transformation is driven by the growth plates, which eventually close up once all the growing is done.
But this immaturity isn't just a weakness. It's also kind of like a superpower. A kid's bone has this thicker outer layer, the periosteum, which gives it a fantastic blood supply. That plus all that cellular activity means they heal way faster than adults and have this amazing ability to remodel, to literally reshape themselves back into place after a fracture.
All right, let's talk about what happens when things go wrong. When there's trauma, the way a child's bone breaks is just different. They don't usually snap like a dry twig. No, they bend, they buckle, and they break in their own very unique ways.
As a pediatric nurse, you're going to see a huge range of fractures. On the left, that's a clavicle fracture. It's actually the most common injury that happens during birth. And on the right, you've got a much more significant fracture in the lower leg. For a big break in a bone like the femur, a child might need to be put in a spica cast, which is this huge cast that goes from the chest all the way down the legs. It just shows how complex managing these injuries can be.
So, instead of clean breaks, you'll see things like this. A buckle fracture is from compression, where the bone just kinda crinkles. A green stick is just like a young green branch. It bends and cracks on one side, but doesn't break all the way through. Now, I want you to pay very close attention to spiral fractures. This happens from a twisting force. Sure, a toddler could get one from a simple fall, but if you see this in an infant who isn't even walking yet, that is a major, major red flag for abuse, because it suggests someone twisted their limb.
Okay, so in the moment when you first encounter an injury, what's your first move? Just remember the mnemonic PRICE. Protect, rest, ice, compression, and elevation. It's your go-to for stabilizing things. But, and this is the non-negotiable part, your absolute top priority, before and after you do anything else, is a full neurovascular assessment. Check that pulse, check sensation, check capillary refill, always.
Of course, it's not all about breaks. There are a lot of other conditions you'll be dealing with. You'll be screening for scoliosis, that curvature of the spine, and you'll see congenital issues, like clubfoot, which needs really early intervention with casting and bracing.
Let's spotlight a couple of big ones. With infants, catching DDH early is so important. One of the key signs you'll look for during a well-baby check is asymmetrical skin folds. Imagine you lay the baby on their tummy, and you look at the little rolls on their thighs or butt, and they just don't line up. That's a huge clue. Treatment is usually a Pavlik harness, which is a special brace that holds the hips in just the right position so that hip socket can develop correctly.
Okay, now let's shift gears to a genetic disorder that requires a whole other level of caution and care. It's called osteogenesis imperfecta, but you probably know it as brittle bone disease.
This image is pretty striking, right? The whites of the eyes have a blue tint. This is a classic sign of the condition. It's all because of a defect in their collagen, which makes their bones incredibly fragile. These kids can get fractures from even the slightest bump, or sometimes for no obvious reason at all.
So for a child with OI, your touch can literally make or break their day. I'm not kidding. Every single thing you do has to be gentle. You have to alert everyone on the team, from the person transporting them to the X-ray tech, that this child needs special handling. Even something as routine as an automatic blood pressure cuff squeezing too tight can cause a fracture. Your role is one of constant, vigilant protection.
Now, we've talked about a rare genetic disease, but let's look at something you will see all the time. Sports injuries. This number, 3.5 million. That's roughly how many sports-related injuries, like sprains and dislocations, happen every year to kids under 14 in the US. It's a massive number, and it really drives home how important your role in prevention and education is. And that brings us right here to the most important part. So, what is your role in all of this? I'll tell you, it's so much more than just managing a cast or giving pain meds. It's about assessing these unique conditions, preventing more injuries, and actively nurturing a child's potential to grow. Your role is huge. You're a clinician, performing those sharp neurovascular checks to prevent serious compromise. You're a detective, always assessing for those red flags of abuse. You're an educator, carefully explaining restrictions to worried families. And you're a collaborator, working side by side with physical and occupational therapists to get that child back to their best. So, we'll end with this. As you move forward, I want you to carry this question with you. Because when you're caring for a child's bones and muscles, you're not just fixing an injury, you are protecting a blueprint. You're safeguarding the very foundation of that child's ability to grow, to move, and to thrive for the rest of their life.